Relatable, slightly sympathetic. We have all experienced that heavy, restrictive pressure after finishing a large meal. Your stomach feels distended, cramps start to build, and you quietly unbutton your pants just to find a moment of relief. The immediate, logical assumption is that your digestive system has turned into an overactive factory, pumping out a massive and abnormal amount of excess gas. In reality, every human body naturally produces between 1 and 3 pints of gas a day, passing it anywhere from 14 to 23 times. It is a completely routine baseline of human digestion. And when doctors actually measure the exact amount of gas inside the intestines, a surprising pattern emerges. Chronic bloaters and completely asymptomatic people harbor the same average volume of gas, approximately 200 milliliters. The physical distension and the agonizing pressure stretching against your waistband are absolutely real. But they are entirely misunderstood by the patient experiencing them. If the raw volume of gas in your gut is completely normal, that post-meal swelling must be the result of a mechanical or neurological failure in how the body processes that gas. To understand where this process breaks down, we must track the physical sources of normal gas. The first is aerophagia, or the unconscious swallowing of air. This happens constantly when you eat food too quickly, chew gum, or drink carbonated beverages. Body posture creates a mechanical trap for swallowed air. Lying flat on your back after a meal causes gastric air to bypass the top of the stomach, where it would normally be released as a burp, and forces it directly into the small intestine. The remainder of your intestinal gas is generated further down the digestive tract, inside the colon, which serves as a home for billions of harmless, symbiotic bacteria. These microbes survive by fermenting specific carbohydrates that the enzymes in your stomach and small intestine fail to fully digest. This table outlines dietary triggers known as FODMAPs. Healthy ingredients like broccoli and bagels, highlighted here, resist digestion. Panning down, beans and peas face the same fate. Gut bacteria ferment these complex sugars, releasing massive volumes of carbon dioxide, hydrogen, and methane. Eating food and hosting bacteria will inevitably create gas in the digestive tract. These routine inputs only transform into agonizing bloating when your gut's hardware severely overreacts. For people dealing with irritable bowel syndrome, or IBS, the primary driver of chronic bloating is an overly communicative, highly sensitive nervous system. This is visceral hypersensitivity. The gut's nerve endings become hyperactive, firing alarm bells that interpret a normal volume of gas as intensely painful and excessive. This neurological sensitivity is often paired with a secondary physiological glitch, a disordered muscle reflex known as abdominophrenic dyssynergia. Normally, as gas builds, the diaphragm moves upward, making room in the abdomen so the belly doesn't expand. But in a bloated patient, this reflex is backward. The diaphragm incorrectly pushes downward, forcing the abdominal wall to visibly protrude despite normal gas volume. The visible physical swelling, the dreaded food baby, is actually a muscular illusion. It is a bulging of the abdomen caused by confused nerve reflexes, not a massive pocket of trapped air. Because severe bloating is ultimately a processing issue, it can be mitigated. You can take control of the discomfort by managing the physical inputs and consciously retraining your internal reflexes. The first line of defense is keeping a strict food diary to isolate and reduce your specific dietary triggers. This helps identify high FODMAP inputs, like lactose in dairy or resistant starches in wheat, that are fueling the excess fermentation. You can also implement immediate behavioral modifications. Eating slower directly limits aerophagia, and maintaining an erect, upright posture after a meal assists your digestive tract in naturally clearing any trapped air. To address the hardware side of the equation, cognitive or speech therapists can introduce therapeutic physical interventions designed specifically to correct that faulty diaphragm reflex. This clinical diagram illustrates diaphragmatic breathing, a proven tool for relieving distension. By placing one hand on the abdomen and inhaling slowly through the nose so that only the lower hand rises, patients can consciously retrain the abdominophrenic reflex. While these interventions solve the vast majority of cases, you should always consult a doctor if your bloating is accompanied by clinical alarm signs, such as nocturnal pain that wakes you from sleep, unexpected weight loss, or blood in the stool. Your body isn't a broken gas factory. It just has a hypercommunicative nervous system. By adjusting what you eat and retraining how your muscles carry that digestion, you can finally deflate the problem.